So how do we use color vision testing in neuro-ophthalmology? And the most common color vision deficit that we see is the congenital hereditary version, which is X-linked and affects up to 8% of males in the United States. And that causes deuteranomaly that results in red-green confusion. It's super common, and that is what the Ishihara color plates were designed to test. So the color plates that we have, Ishihara, most commonly, is designed to detect congenital red-green color blindness, X-linked in males. However, we use these plates for acquired dyschromatopsia in neuro-ophthalmology clinic, and it's kind of our secret weapon, because the reason the color vision is important is the color goes down sometimes before the acuity. And so conditions like optic neuritis tend to affect the color vision first. And you might be 20/20, but have only 5 out of 14 color plates compared to the normal eye, 14 out of 14. So the color vision is a really good test for us to help us differentiate maculopathies like macular holes or macular edema, which normally don't affect the color vision, from optic neuropathies, but especially optic neuritis. And even amongst optic neuropathies, optic neuritis is way more likely to cause dyschromatopsia than non-arteritic anterior ischemic optic neuropathy. So it's really good for detecting subtle optic neuropathies. In addition, you don't even have to do the color plates. You can just use a red top, like the top of the dilating drop, and just compare between the two eyes, because you have the other eye as a control in a compressive lesion on one side. Is it red, equally red in this eye compared with this eye? Oh, it's only 50% is red. And we can use the red top across the vertical meridian to test for homonymous and bitemporal hemianopsias in patients who have optic neuropathies or chiasmopathies. You can detect the vertical step by putting the red on either side of that vertical meridian. And the other thing that we use is the Ishihara color can detect simultagnosia. So as you know, in a patient who has simultagnosia, they can't see the forest for the trees. So the numbers are made up of colored dots, and so they can see that there's something in there, but they can't tell it's a 12. So they might have 0 out of 14 color plates, even though they actually have reasonable hue discrimination and actually can tell you that these are different colors, but they can't put the whole thing together. So Ishihara color plate can be used as a test for simultagnosia. And so you need to know a little bit about color vision. It's our secret weapon. It's really good for detecting subtle optic neuropathies, detecting the differences between maculopathy and optic neuropathy, especially optic neuritis. You can use the red top tube and use it across the vertical meridian to detect the vertical step. And it's good for detecting simultagnosia.